Did you know that nearly 12% of the population in the United States has diabetes? Welcome back to our Riverside Chats. Today we're talking diabetes, a chronic medical condition that occurs when the body is unable to properly process blood sugar, otherwise known as glucose, leading to elevated levels of glucose in the blood. There are several types of diabetes, and the disease can range from mild to severe depending on the type and how well it's managed. I bet you think there are only two types of diabetes when, in fact, there are four. Let's break them down. Type 1 diabetes is an autoimmune condition where the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas. This means that the body can no longer produce insulin, a hormone that helps regulate blood sugars. People with type 1 diabetes need to take insulin for the rest of their lives to manage their blood sugar levels. Insulin can be injected or administered through an insulin pump. Type 2 diabetes is more common and is often linked to lifestyle factors such as poor diet, lack of exercise, and obesity. In type 2 diabetes, the body either doesn't produce enough insulin or the cells become resistant to insulin, which means glucose builds up in the blood. Type 2 diabetes can often be managed with lifestyle changes such as diet and exercise. In some cases, medication or insulin may be needed if the lifestyle changes are insufficient. Now, the third type of diabetes is gestational diabetes. This type of diabetes develops during pregnancy and affects how the body processes glucose. It typically goes away after the baby is born, but it does increase the risk of developing type 2 diabetes later in life. Managing gestational diabetes involves diet changes, regular monitoring of blood levels, and sometimes insulin if needed. And lastly, prediabetes. Prediabetes is a condition where blood sugar levels are higher than normal but not high enough to be classified as type 2 diabetes. It's often a precursor to type 2 diabetes, though. Lifestyle changes, including weight loss, healthier eating, and increased physical activity, can help prevent the progression to full-blown type 2 diabetes. Diabetes affects millions of people worldwide and is the leading cause of developing other complications such as heart disease, kidney failure, blindness, and amputations. Diabetes, especially type 2 diabetes, is becoming more common globally due to factors like aging populations, urbanization, poor diet, and a sedentary lifestyle. In the United States, the Center for Disease Control and Prevention reports that over 37 million people have diabetes, with an additional 96 million adults estimated to have prediabetes. Why is the prevalence rising? Well, aside from portion sizes, overly processed food, and lack of affordable healthy options, there are a number of risk factors that contribute. Type 1 diabetes has genetic factors. Autoimmune issues are the main cause, though the exact cause isn't fully understood. Type 2 diabetes is attributed to obesity, a sedentary lifestyle, poor diet, family history, and age. The older you get, the higher the risk of developing diabetes. There are also ethnic groups that are more genetically predisposed than others to develop diabetes, like those of African, Hispanic, Native American, or Asian descent. Gestational diabetes is a little different. Women who are overweight or have a family history of diabetes or who are over the age of 25 are at higher risk of developing gestational diabetes during pregnancy. Think you might be diabetic? First, if you have a family history of diabetes, go talk to your doctor. Some symptoms of diabetes are increased thirst, frequent urination, unexplained weight loss or weight gain, extreme hunger, fatigue, blurred vision, slow healing wounds or sores, and numbness or tingling in the hands or feet, though this one is more common in type 2 diabetes. There's no surefire way to prevent diabetes, but there are a few tips that can help. Type 1 diabetes. There's no known prevention for type 1 diabetes because it's an autoimmune disorder. But type 2 diabetes can often be prevented or delayed through lifestyle changes. Maintaining a healthy weight, eating a balanced diet, exercising regularly, and avoiding smoking are critical. Gestational diabetes, while it can't always be prevented, maintaining a healthy weight before pregnancy and managing blood sugar during pregnancy can reduce the risk. Diabetes is a very manageable chronic illness. With proper treatment and lifestyle changes, you can live a fairly normal life. Hope this brief overview of diabetes has given you some food for thought. Thanks for watching, and as always, stay happy and healthy. Until next time.